Imagine a silent enemy coursing through your veins, capable of stopping your heart without warning. Millions of people around the world face this threat every day, unaware that small choices can be their greatest defenses. How can something as simple as the vitamin you take at breakfast or the route you choose for work influence the health of your heart? Let's find out together which seemingly innocent habits might be putting your life at risk, and how simple changes can strengthen your heart against this hidden adversary. The heart is the engine of the human body, pumping blood through miles of arteries and veins, providing oxygen and essential nutrients to all cells and tissues. Cardiovascular health refers to the proper functioning of this vital system, which includes not only the heart, but also an extensive network of blood vessels. Keeping the system in optimal condition is crucial, as any dysfunction can lead to serious complications such as myocardial infarction and stroke. Therefore, cardiovascular health not only supports physical activity and vitality, but is also essential for longevity and quality of life. Understanding the importance of the cardiovascular system and how it operates is the first step in properly caring for it. This complex system requires balance and constant regulation to function effectively, involving processes from blood pressure regulation to maintaining blood fluidity. Moreover, healthy arteries are essential to prevent atherosclerosis, a condition where fat plaques build up on artery walls, restricting blood flow. Thus, heart health is intrinsically linked to overall well-being, emphasizing the need to adopt a healthy lifestyle and regularly monitor cardiovascular function. The risk factors for cardiovascular diseases are numerous and varied, encompassing genetic, dietary, and behavioral aspects. Genetics play a significant role, with certain hereditary conditions increasing the risk of hypertension, high cholesterol, and congenital heart diseases. However, even those predisposed genetically can mitigate their risks through healthy lifestyle choices. On the other hand, diet directly impacts cardiovascular health. Diets high in saturated fats, salt, and simple sugars can lead to the development of atherosclerosis, hypertension, and eventually heart diseases. In addition to diet and genetics, lifestyle is a crucial factor in preventing cardiovascular diseases. Sedentarism is one of the heart's greatest enemies, while smoking directly contributes to vascular and respiratory deterioration, exacerbating cardiovascular risks. Chronic stress is also a significant contributing factor, as it can lead to hypertension and unhealthy habits such as overeating and smoking. By recognizing these risks and adopting proactive health strategies, such as regular exercise, a balanced diet, and abstaining from tobacco, individuals can significantly improve their cardiovascular health and reduce the risk of future diseases. Vitamins play a crucial role in maintaining arterial health, helping to prevent the accumulation of fat deposits and calcification that can lead to cardiovascular diseases. Among them, vitamins K2, C, and E are especially important due to their properties that favor arterial elasticity and cleanliness. For example, vitamin C is a powerful antioxidant that protects the vascular endothelial cells from oxidative damage, while vitamin E helps to combat the oxidation of LDL cholesterol, the bad cholesterol, which is a key precursor to atherosclerotic plaque. Vitamin K2, on the other hand, acts slightly differently, facilitating the mobilization of calcium from the arteries to the bones, where it is needed, thus preventing its deposition in arterial walls. Moreover, studies indicate that an adequate supply of certain vitamins can reverse the processes leading to plaque formation in the arteries. Niacin, or vitamin B3 for example, has been used to raise HDL, the good cholesterol levels, and reduce LDL and triglycerides, lowering the risk of atherosclerosis. In addition to its antioxidant role, vitamin C also contributes to the synthesis of collagen, essential for maintaining the integrity and repair of blood vessel walls. Therefore, a diet rich in essential vitamins not only keeps the arteries clean, but also strengthens the entire cardiovascular system, protecting it from future diseases. Vitamin K2 is essential in preventing arterial calcification, one of the main risk factors for cardiovascular diseases. This vitamin regulates calcium use in the body. More specifically, it helps direct calcium to the appropriate places, such as bones and teeth, and prevents it from depositing in the walls of the arteries. Such deposition can lead to arterial stiffness and, eventually, more severe conditions like atherosclerosis. Vitamin K2 activates proteins that inhibit vascular calcification, making it a valuable ally in maintaining flexible arteries and promoting healthy blood circulation. Recent studies have shown that adequate intake of vitamin K2 is associated with a reduced risk of death from cardiovascular diseases. The MGP protein, matrix GLA protein, which is activated by vitamin K2, is one of the most potent inhibitors of arterial calcification found in the human body. Therefore, a deficiency in vitamin K2 can lead to insufficient MGP activity, resulting in increased arterial calcification and cardiovascular risk. Thus, ensuring adequate levels of vitamin K2 through diet or supplementation is an effective strategy for cardiovascular health, especially for those already at risk for heart diseases. Vitamin C is widely recognized for its powerful antioxidant effect, which plays a crucial role in protecting against vascular damage caused by free radicals. These free radicals can oxidize LDL cholesterol, a fundamental precursor in the formation of atherosclerotic plaques that clog the arteries. By neutralizing these free radicals, vitamin C helps prevent this oxidation, thus reducing the risk of developing cardiovascular diseases. Additionally, vitamin C is essential for the synthesis of collagen, an important component of the walls of blood vessels. With a stronger and more flexible vascular structure, the risk of conditions such as hypertension and arterial diseases is significantly reduced. Another important aspect of vitamin C in vascular health is its ability to regenerate other antioxidants, such as vitamin E. This regeneration process amplifies the body's ability to combat oxidative stress. Vitamin C also facilitates the absorption of non-heme iron, which is crucial for oxygen transport in the blood and helps reduce blood pressure by dilating blood vessels. With these properties, vitamin C not only protects the arteries from damage, but also improves the overall functionality of the cardiovascular system, contributing to more efficient blood circulation and enhanced cardiovascular health. Vitamin E is another vital antioxidant that provides substantial protection against heart diseases. Its primary function in the cardiovascular context is to protect the blood cells and the walls of blood vessels from harmful oxidation. The oxidation of LDL cholesterol is one of the primary causes of plaque formation in the arteries, and vitamin E helps prevent this process. Studies show that adequate intake of vitamin E is associated with a lower risk of heart attacks and strokes, thanks to its ability to improve vascular health and reduce inflammation within blood vessels. In addition to its antioxidant properties, vitamin E also plays a role in dilating blood vessels, which can help reduce blood pressure. This effect is complemented by its ability to inhibit platelet aggregation, a process that can lead to the formation of blood clots. Combining these actions, vitamin E not only helps keep the arteries free of harmful deposits, but also ensures blood fluidity and the prevention of thrombotic complications. Thus, including vitamin E in the diet is essential for those looking to strengthen cardiovascular health holistically. Niacin, also known as vitamin B3, plays a well-established role in managing lipid levels in the body, being particularly effective in reducing cholesterol. It works by increasing levels of HDL, good cholesterol, and reducing levels of LDL, bad cholesterol, and triglycerides. This adjustment in the lipid profile is vital for reducing the risk of atherosclerosis, a condition that occurs when fat deposits clog the arteries, potentially leading to severe cardiac events such as myocardial infarction and stroke. Niacin also has anti-inflammatory properties, which help reduce internal inflammation of blood vessels, a significant risk factor for cardiovascular diseases. In addition to its impact on cholesterol levels, niacin improves cardiovascular health through its vasodilatory effect, which relaxes blood vessels and improves circulation. This effect is especially beneficial for patients with peripheral arterial disease, a condition that causes pain and fatigue in the muscles due to insufficient blood circulation. By improving blood circulation, niacin not only alleviates symptoms, but also reduces the risk of more serious complications associated with poor circulation, such as ulcers and infections in the limbs. Therefore, niacin supplementation, under medical guidance, can be an effective strategy for maintaining cardiovascular health. Vitamin D, often called the sunshine vitamin, is crucial for various bodily functions, including cardiovascular health. Recent research suggests that vitamin D may play a significant role in regulating blood pressure. Deficiencies in vitamin D have been associated with an increased risk of hypertension, as this vitamin helps regulate calcium and phosphate levels in the body, elements that are important for maintaining vascular and muscle health. Vitamin D also influences the renin-angiotensin-aldosterone system, which controls blood pressure, fluid volume, and electrolyte function in the body. Thus, maintaining adequate levels of vitamin D is crucial for blood pressure stability and the prevention of hypertensive disorders. Additionally, vitamin D plays a role in preventing arterial diseases by directly influencing the health of the blood vessel walls. It promotes endothelial health, the layer of cells that lines the interior of blood vessels, and reduces the risk of atherosclerosis, one of the main causes of cardiovascular diseases. Vitamin D can decrease arterial stiffness and improve vascular elasticity, thereby reducing the risk of heart diseases and strokes. Due to these effects, vitamin D supplementation can be an important preventive intervention, especially in regions with low sunlight exposure where deficiency of this vitamin is more prevalent. Folic acid, or vitamin B9, is essential for vascular health due to its role in reducing levels of homocysteine, an amino acid that at high concentrations is associated with an increased risk of cardiovascular diseases such as heart attacks and strokes. Homocysteine contributes to endothelial damage and the formation of plaques in the arteries, facilitating atherosclerotic processes. Folic acid aids in the metabolism of homocysteine, converting it into methionine, a benign amino acid, and thus reducing its concentration in the blood and consequently the risk of cardiovascular issues. Additionally, this vitamin is essential for the formation of healthy blood cells, helping to maintain good circulation and oxygenation of body tissues. In addition to its role in homocysteine metabolism, folic acid exerts a protective effect on blood vessels by promoting the formation of new endothelial cells, essential for the repair and maintenance of arterial wall integrity. Studies indicate that adequate folic acid supplementation can not only prevent the progression of atherosclerosis, but also improve endothelial function in individuals with existing arterial disease. Thus, folic acid is seen as a vital component of a preventive approach against cardiovascular diseases, recommended both in the diet and as a supplement, especially in high-risk populations. Processed foods, rich in salt, sugar, and trans fats, play a significant role in increasing the risk of cardiovascular diseases. Excessive salt intake contributes to hypertension, a primary risk factor for the development of heart diseases and strokes. Additionally, trans fats, often found in processed foods like snacks, cookies, and fried foods, are known to raise LDL, bad, cholesterol levels, and lower HDL, good cholesterol, exacerbating the risk of atherosclerosis. The overconsumption of simple sugars, especially fructose, has been linked to increased obesity, vascular inflammation, and insulin resistance, all contributors to compromised cardiovascular health. Beyond their direct effects on cardiovascular health, processed foods also promote unhealthy eating habits, leading to a vicious cycle of poor nutrition and chronic diseases. These foods tend to be low in essential nutrients, such as fibers and antioxidants, which are crucial for maintaining the integrity of the cardiovascular system. Replacing whole, nutrient-rich foods with processed options can result in nutritional deficiencies that, over time, can cause significant damage to heart health. Therefore, to promote cardiovascular health, it is advisable to minimize the consumption of processed foods and opt for a diet rich in fruits, vegetables, whole grains, and lean proteins, which support healthy heart function and reduce the risk of heart diseases. A healthy diet plays a crucial role in preventing cardiovascular diseases, with the Mediterranean diet widely recognized for its benefits in promoting heart health. This diet emphasizes the consumption of foods rich in monounsaturated and polyunsaturated fatty acids, such as olive oil, nuts, and fatty fish, which are known to lower bad LDL cholesterol levels and increase good HDL cholesterol. Additionally, the Mediterranean diet includes plenty of fruits and vegetables, whole grains, and limits red and processed meats, offering a rich source of antioxidants and fibers that help keep the arteries clean and cardiovascular health optimized. Other diets that favor cardiovascular health include the DASH diet, dietary approaches to stop hypertension, specifically designed to reduce high blood pressure. This diet highlights the importance of foods rich in potassium, calcium, and magnesium, such as leafy greens, fruits, nuts, and low-fat dairy, which are essential for arterial health and blood pressure regulation. By reducing salt intake and increasing the consumption of blood pressure-lowering foods, the DASH diet not only helps manage hypertension, but also reduces the risk of heart diseases. Adopting these dietary approaches not only improves cardiovascular health, but also contributes to more robust overall well-being. Regular physical exercise is essential for maintaining cardiovascular health at all stages of life. Activities such as walking, running, cycling, and swimming help strengthen the heart, improve blood circulation, and enhance the efficiency of the respiratory system. Aerobic exercises in particular are beneficial in reducing blood pressure, lowering cholesterol, and preventing plaque buildup in the arteries. Additionally, regular physical activity helps maintain a healthy weight, which significantly reduces the risk of developing heart diseases. Incorporating an exercise routine into daily life is not just an effective preventive measure against cardiovascular diseases, but also improves mental health and quality of life. Strength training, such as weightlifting, can improve muscle strength and bone density, reducing the strain on the heart during daily activities and minimizing the risk of injuries that can compromise cardiovascular health. Chronic stress is a significant factor that contributes to cardiovascular problems, negatively impacting heart health in various ways. Under stress conditions, the body releases hormones such as cortisol and adrenaline, which increase heart rate and blood pressure, preparing the body for fight or flight. While useful in short-term situations, these physiological responses can cause wear and tear on the cardiovascular system if they occur frequently due to chronic stress. Moreover, many people under stress tend to adopt unhealthy habits such as smoking, excessive drinking, and eating unhealthy foods, further exacerbating the risks of heart diseases. To manage stress and mitigate its effects on cardiovascular health, it is essential to adopt effective stress management strategies. Relaxation techniques such as meditation, yoga, and deep breathing can help reduce stress levels and promote a state of calm and relaxation. Throughout this article, we explore how a combination of proper diet, regular physical exercise, effective stress management, and the supplementation of specific vitamins can significantly promote cardiovascular health. Vitamins K2, C, E, D, niacin, and folic acid were highlighted for their crucial roles in preventing cardiovascular diseases by reducing the risk of atherosclerosis, strengthening arterial walls, and improving endothelial function. Implementing these nutrients in your daily diet, whether through food or supplements, is a key strategy for keeping arteries healthy and the heart functioning efficiently. To integrate these findings into daily life and maximize arterial health, follow this step-by-step plan. 1. Consult a healthcare professional to assess your vitamin levels and adjust your diet or supplementation as necessary. 2. Incorporate aerobic and strength exercises into your weekly routine, aiming for at least 150 minutes of moderate activity. 3. Adopt a Mediterranean or DASH diet, rich in fruits, vegetables, whole grains, and essential fatty acids. 4. Practice daily stress management techniques, such as meditation or yoga, to keep stress levels under control. 5. Regularly monitor cardiovascular health through exams and medical consultations. By following these steps, you can significantly improve the health of your arteries and reduce the risk of cardiovascular diseases. As we conclude our journey today, it becomes clear that the choices we make every day have a monumental impact on our cardiovascular health. But what will happen if we start implementing small changes now? Can we reverse the damage or even prevent future heart diseases? Consider this. Every step you take, every food you choose to consume, every moment of calm you allow yourself may be building your shield against the world's leading killer. So, What will be your next step towards a healthier heart? Keep exploring, keep questioning, and most importantly, keep acting. The power to change your health is in your hands.